My name is Dr. Karl Henson. I'm an adult infectious disease specialist and the director of the Hospital Infection Control and Epidemiology Center at the Medical City. And I've been asked to answer some questions about monkeypox. Monkeypox is a virus. It's one of a family of viruses called orthopox viruses, and it's actually a zoonotic infection. When we say zoonotic, it comes from an animal that's transferred to humans. It causes a range of symptoms, the most dramatic of which are the skin lesions, which you can see right here. Monkeypox spread through close contact. So that means face-to-face, skin-to-skin, mouth-to-skin, skin-to-mouth. And in this recent outbreak this year, they've found that a lot of the cases are sexually transmitted, so transmitted during sexual intercourse, and that's why it's harder to transmit, or relatively harder to transmit compared to COVID-19, and you really need to be up close and personal with someone who has monkeypox in order to get it. Anyone can get monkeypox. You need to be up close and personal with someone to get monkeypox, but everyone, I think, is susceptible. The older generation might be a little immune to it if they receive the smallpox vaccine. But at this point, almost everyone would have immunity that's waned, so everyone's susceptible already. Whether you are a child or an adult or an elderly, you can get it. The mechanism of transmission, the way you transmit monkeypox, like I said, is through close contact. So if you find yourself or you know someone who has monkeypox, staying away is a good idea. Keeping distance from that person. Wearing a mask is also important, especially since there's some evidence that it can generate like you can transmit it through short distance through the air. It's not known to be airborne like TB or chickenpox, but when you're a short distance away and say the person coughs and then you inhale that infected material, then you can also get it that way. It's also possible, for example, someone who has monkeypox at home stays in bed, and then the bed is fluffed, so the particles of virus can go up into the air and you can inhale that and you can get infected that way. Regularly washing your hands, the usual stuff that we do for COVID, will actually work also against monkeypox. There is a vaccine against monkeypox. Unfortunately, we don't have it here. The older generation vaccines against smallpox, which is a relative of monkeypox, actually gives cross protection. Now we have 2 vaccines that are available for monkeypox. Again, not available yet in the Philippines. The goal is to vaccinate those who have been exposed by someone with monkeypox, so that's called post-exposure prophylaxis, or healthcare workers or laboratory personnel who work in settings where they have monkeypox, so in other countries. Those are the people who are priority to receive the vaccine. So at this point, there is no word yet from government if we will have the vaccine here, but there are 2 vaccines that are available. Okay, so the symptoms of monkeypox, like I said, the classic picture is, this rash right here. The classic rash starts off as what's called a macule. So it's a reddish or brownish discoloration that's flat, and then eventually it will become a papule. So it will have like a little bump no? And then it will become fluid-filled, like this picture here, and then it will rupture, and then scab off, and then eventually the scab will fall off. The pattern is a little similar to chickenpox or bulutong, but in chickenpox, the age of the lesions and the stage of the lesions are all different. No? You can catch some lesions that are in the macular stage, meaning the flat stage. You can also catch some lesions in other parts of the body that are fluid-filled, or the vesicle stage. In monkeypox, the age or the stage is all the same, all at the same time. So they all are macules, and then they become papules, and then they become vesicles, pustules. They scab off all at the same time. So same stage throughout the body. In addition to the rash, you can also get fever. You can also get swollen lymph nodes, no? And then whatever comes with fever, muscle aches and pains, etc. So those are the usual manifestations. Now, they've found that the cases these days in the outbreak, they have atypical symptoms. Usually the rashes, there are a lot. They are concentrated in the mouth and the face compared to the rest of the body. But in some cases, or in a lot of cases these days, there can only be one or a few lesions. No? So very atypical symptoms. So it's important that if you think that you might have contracted monkeypox because you had, say, an exposure to someone who's sick, etc., to see your doctor immediately so that you can get the proper testing. Okay, so that's an important question, because making sure that we diagnose you early and isolate you early is very important. So when you think, or if you think that you got monkeypox, so you have a rash, you got a fever, or you think you were exposed to someone with monkeypox, it's important for you to consult your doctor immediately. There are now many ways to consult doctors. Teleconsultation is one, for example, no? Or if you feel really sick, you can go to the nearest emergency room to get medical attention. So we go back to the mechanism or the mode of transmission. No? It's close contact with the possibility of some short-range contact. No? So if you think that you have monkeypox, it's important for you to isolate yourself immediately. If it's possible for you to stay in your own room in your house, no, until you are able to talk to a doctor, then great. If it's not possible in your home setup for you to have your own room, make sure that you stay away from your relatives at home. Pick a corner where you can rest and sleep away from the rest of the people. Make sure that everyone is wearing a mask in the house, and then have everyone wash their hands regularly. If it's possible for you to get your own toilet facilities, that's great. But if it's not, you share a toilet with other people. Make sure that the toilet is cleaned after you use it, no? And before someone from the rest of the group or rest of the household uses it. Just to make sure that the virus is not transmitted in the home. In most cases, monkeypox will go away on its own. It's what's called a self-limiting infection. No? So when you get sick, you can get symptoms, you can get the rash for as long as, say, 3 weeks now before all the scabs come off. And during that time, there really is no need for any specific medication. You can take a paracetamol if you have a fever, or if you can take one of those medicines for throat pain if you have a sore throat, etc. Yes, people can get ill, can get seriously ill, and they can actually die from monkeypox. It's not very common, actually quite rare. In the previous outbreaks of monkeypox in Africa, the case fatality rate was around 1 to 10%. very small numbers. And these were mostly seen in children because they had weaker immune systems. So adults and adolescents can have just very mild self-limited infections, no? But it can happen. And how does it happen? Usually the patients can get what's called a secondary bacterial infection. So in addition to monkeypox, they get a bacteria either on the lesion itself, it gets infected, or they get a pneumonia and develop sepsis, etc. So it is, I think, still a good reason to make sure that you protect yourself and not get the infection, even if in most cases it's going to be a mild infection. If you think that you were exposed to monkeypox or you think you have it, the most important thing to do is, number one, to self-isolate, whether in your own room or in a separate corner of your house, and then you need to call your doctor. Make sure that you stay vigilant. We've talked to you about the most common symptoms and how to get monkeypox or how you can get it. So just remember those things and then let your doctor know if you think that you have been exposed so that you can get proper attention and possibly get tested for it.